Now joining the discussion is Dr. Doreen, along with board-certified neuropsychiatrist, Dr. Daniel Emina.
Hey, Dr. Emina. Doc, let's dive right in. What are your thoughts on using TMS therapy off-label for autism?
It's quite common, and unfortunately, because certain tools that we have that are more on-label aren't as readily available, or someone may struggle with finding the benefit they would hope to find from those particular tools. So off-label use is quite common. And I will just quickly add, so is informed consent, which basically means you're giving the risks, the benefits, the alternatives, and being clear and honest and saying this is an off-label option. Good psychiatric care is at times off-label.
All right, well, I think we have a little debate, little controversy here. Dr. Doreen, what do you think about this therapy on kids with autism?
Well, you know, the definition when we say off-label basically means that this particular intervention has not been studied in this particular population. So the problem for me, having, I've been seeing children on the spectrum of autism for 40 years, is that just as exciting as it is when it works for one child, it is damaging in a lot of other ways when it doesn't work. And during this period of time when the family's putting all of their effort into this, it's also a period where they're not doing other things that could potentially be helping their child. So in that sense, I wish more studies would be done before we try these interventions.
Yeah, she brings up a great point. We don't know what it's going to do in our kids. Right?
We don't.
And we don't know the long-term side effects of that. And so that's a great point, Dr. Doreen. It really is.
But at the same time, the proponents are seeing results. And on that note, Miriam, we want to get you back into the discussion. What is your response to what Dr. Doreen just said?
I'm not a doctor. I'm a mom. And so it's devastating when something that works for one child doesn't work for another. But that is autism. So if our kid's brain is like an orchestra and it has all the instruments, the violin, the cello, the piano, what they lack, and we know this because we have many EEGs done to autistic children, is a reliable conductor, one that will organize and synchronize those brain waves or that orchestra so that the music will flow. And that is why when I went with my daughter who had an extremely disorganized brain, when things started to organize and synchronize, she started to speak, she started to become part of this world, she became present, her anxiety was crippling. It was no longer there because she could see the world the way it truly was because her brain was perceiving it in the correct manner.
Miriam, it gave her a totally new lease on life, and I think the take-home, Doc, is, but it's got to be on a case-by-case basis.
That's right. We have a dilemma here. Clearly, we need more questions answered, but at the same time, what are parents that need something done now
Today.
to do?
Right.
All right. Thank you,
Thank you,
Miriam,
guys.
Dr. Doreen,
Thank
and
you,
Dr.
guys.
Emina. Thank you. Great discussion.